Do we have a go time on when we should start talking, or?
Well, you want to wait for participants, right?
Yes, I think that would be a good idea.
Yeah.
It looks like we have, I thought I saw 18.
I'm seeing, oh, okay. I'm only seeing 3. Gotcha. I see. Okay. So there are lots of people are joining. So we're just going to give a few minutes for other participants to join, and we'll get started here shortly. Thank you, everybody, for joining the webinar. And we'll be using the chat window during the webinar if you have any questions.
I can undo my video, this for the beginning.
So Danielle or Samantha, maybe if y'all could help let me know if there are any questions that join in, because I'm probably going to have those windows minimized so I can see the presentation.
Yeah, that's totally fine. Looks like we have a few more that have joined us.
Mm-hmm.
Cool. I have a few more here. There's also, we just will pay attention to Q&A as well as the chat.
Okay.
Doing that, sorry.
So let's just give it another minute, and then we'll go ahead and get started. Again, thanks everybody for joining the webinar. We're going to talk about the John H. Magill School Mental Health Certificate Program that the Department of Mental Health and the School Behavioral Health team at University of South Carolina have put together. Glad to hear we're coming in loud and clear.
Thanks. Yeah, thanks for that.
So if those that may not know, this is not necessarily part of the presentation, but the School Behavioral Health team at the University of South Carolina is led by Dr. Mark Wiest, and Dr. Courtney Smith is the director of that team, and Samantha is a doctoral student that's been leading the work on the USC side for this this certificate program. And I'm sure most, I am familiar with Dr. Wiest and his work. He's nationally and probably internationally recognized for his research and work in school mental health. And we're really privileged to have him here in South Carolina working with the Department of Mental Health, in addition to PBIS and other school mental health related initiatives. So we can go ahead and get started. We've got a good number of participants with us. Again, I'm Christian Barnes-Young. I'm the Assistant Deputy Director for Community Mental Health Services at the Department of Mental Health. One of the programs under my supervision is School Mental Health, which I'm really excited about. And one of the things that we've done at the Department of Mental Health is to develop this John H. Magill School Mental Health Certificate Program. And I think we're going to refer to it as the Magill Certificate going forward, now that we all know that it's the John H. Magill Certificate Program. And then I'll let Samantha introduce herself, and then we'll go ahead and get started.
Hi, everyone. Thanks for joining us today. My name is Samantha Martinez, and I am just finished my first year PhD student here at the University of South Carolina in the school psychology program and work with the school behavioral health team. And Mark and Courtney, and we've all been in helping the Department of Mental Health develop the John H. Magill School Mental Health Certificate Program, the Magill Certificate. And it's been a really great journey this first go around. So I'm excited to share that with you, as well as talk to you all about what our hopes are for the future with Cohort 2.
So it is a mouthful. We recognize that. I think we decided for the abbreviation to be the Magill Certificate, because the acronym that this goes to is doesn't really roll off the tongue either. So the Magill Certificate it is. All right. So to start the presentation, we're going to give a little bit of background about the School Mental Health Services. And with the Department of Mental Health, they started in the 90s. We recognized the benefits of providing mental health services in schools. And the first program was started in 1995 in Greenville. And since then, it's grown rapidly. So we're currently in over 730 schools. I think that's around a penetration rate for public schools in South Carolina around 58%. We've also recognized the need during that expansion for some independent evaluation and consultation services for how we are expanding school mental health services, how school mental health services are being delivered in the schools. And so we're listing there some of the things that we've contracted with the school behavioral health team at University of South Carolina to help us improve how we are expanding school mental health services. So some of those include, just implementation of best practices. We want the school mental health programs to be consistent across the state. So one of the things that Dr. Wiest and his team have been helping us with is just recognizing national trends and best practices in school mental health. So he's helped us and really encouraged us to go for the one-to-one model, having one school mental health clinician in one school as a recognized best practice across the country. For many reasons, that's not always a model that we can sustain initially, but we do strive to have one counselor for one school. And some other areas where Dr. Wiest and his team have helped us with include training and workforce development, which is particularly relevant to this webinar's topic, and our data collection of our program outcomes. They've helped us on a yearly basis complete a survey of school administrators where we have our school mental health programs. And the feedback from those school administration surveys has been overwhelmingly positive. We're really proud of the work our school mental health clinicians are doing in public schools in South Carolina. One of the things that stand out to me is that overwhelming majority of the school administrators say that the students in their school would not receive school mental health services were it not for the school mental health program at the Department of Mental Health. So just some of the benefits of having a partnership with the USC team and with our program evaluation. Another thing that they've helped us with is to develop the advisory board, the School Mental Health Advisory Board. So it meets on a quarterly basis. We've got really good representation across the state on that advisory board. So not only from within the Department of Mental Health and USC, but we've got people from school districts represented on the advisory board, and they hear about what's happening with the school mental health program and provide recommendations and just make sure that we're doing the best we can to meet the needs of students in public schools in South Carolina. If you're interested in participating in that, there's contact information at the end of the presentation, and we just email us, and we'd love to share information about when the advisory board is meeting again.
I do want to mention also throughout the presentation, we hope that everyone is kind of active, and if you have questions throughout, please put it in the chat. We definitely want to get to those. We have kind of a designated time period at the end of the presentation, but we want this to be interactive, and we want to be able to talk through it. We are certainly excited about the certificate program, but understand that sometimes some things may not be exactly clear. So please stop us at any point, and we definitely want to chat with you all about the certificate program. I just kind of wanted to mention that.
Absolutely. All right. One of the things we're really proud about is that our previous state director, who this program is named after, Mr. Magill, and Superintendent Molly Spearman, they were able to craft a joint letter of support for school mental health program. And between our two state agencies, we've developed the 2022 vision. And that it's a very simple vision, but it is a lofty goal. It's an ambitious goal, but we want school mental health programming, school mental health services to be available to all students in South Carolina by the year 2022. So as I mentioned before, we're in about 58% of the public schools currently. So we anticipate we're going to need about another 400 school mental health clinicians to reach that goal. When we look at how we're going to reach all of the public schools in South Carolina, one of the things that we're going to be utilizing is, for the most part, to help us get to that goal is that 1-to-2 model, having one clinician serving 2 schools. And we often do that to start, at the start when we hire a clinician, having them serve 2 schools. And then as caseloads grow and we see where referrals are coming from in one school, we hope to be able to transition the school mental health clinician to just serving 1 school, and then hire another clinician to fill the position where at the other school where they're leaving. So that's one of the approaches that we're working with USC to reach that 2022 goal of having school mental health available to all students in South Carolina by 2022.
We do have a question, and Christian, I think you could probably best answer this, is how do you define school mental health professionals?
So a school mental health professional is, we have a title in the Department of Mental Health, mental health professional is our clinicians. That's who provides the bulk of our services in our clinics and in our outstation positions. We do have some internal classifications, that's the broad category, but there's not a 1 degree program that produces a mental health professional. And that's something that we wanted to do through this program, was to reach all of the degree programs who can graduate a student, who produce a graduate that can be credentialed to become a mental health professional. So it depends on the coursework that they take. They have to have diagnostics and assessment and interviewing, psychotherapy, group therapy, family therapy. So we're looking at the coursework that they've completed during their graduate program. And then they're able to be credentialed as a mental health professional here at the Department of Mental Health. And then whenever we have a mental health professional who is embedded in a school, then that's a school mental health professional.
And I think we'll see how multidisciplinary even our certificate program in this first cohort is, and we've been able to connect with various graduate programs, which I think has been really great.
And having that, being able to hire a mental health professional from a variety of degree programs is a great thing. That certainly opens up our recruitment pool. But it also creates, for this program, the certificate program, it created a few challenges so that, our certificate program is meant to fulfill the degree requirements for internships or practicum placements. So if a degree in creating this certificate program, we needed to work closely with the degree programs to make sure that it was flexible enough to include all the degree programs, but also specific enough to meet the degree requirements for individual programs. So it occurred to me when we were looking at this ambitious goal of having school mental health clinicians available to all students, that's a big recruitment challenge. And we've struggled with recruitment at the Department of Mental Health for mental health professionals just in general. But one of the sticking points for our outstation positions, which our school mental health positions are outstation positions, is that our mental health centers have typically been looking for 2 and sometimes up to 5 years experience after someone has a master's degree to be placed in a school mental health position. So we started thinking about how could we develop a program where we could demonstrate that people with a master's degree could demonstrate that they had the skills and the professionalism needed to work in those outstation positions without those 2 to 5 year, experience positions. Also, we've also noticed that as people get those more, get more years of experience after their graduate degrees, there's more competition for those jobs. So being a state agency, we're not always in the best position to salary wise. We've got other benefits that help us recruit people. But by the time someone has 5 years experience and they're not already, familiar with the Department of Mental Health, we haven't had much success in recruiting them. So this degree program was to help address some of those concerns. And we were fortunate enough to get senior leadership buy-in, and they supported us, and they've been very supportive. So I've got to thank them a lot. Deb Blaylock, our previous state director, John Magill, our medical director, Dr. Bank, and Mark Binkley was the deputy director for administration. He's now our interim state director. And now our current deputy director for administration is Debbie Calcote. They've all been very supportive of the program, and I got to give them a lot of credit for that.
I also want to mention that the experience that they're getting during the certificate program, and we're going to go over that in some detail, is very specific. And the idea is to get them experiences that they might not even get during that 2 to 5 years that they're supposed to be getting before coming into the Department of Mental Health in this SMH positions. And so we are very particular about the experiences that we can get to hopefully fill those gaps, or that the students will get to hopefully fill those gaps. So, and you'll see that later in the presentation. Mm-hmm. I think this is relatable to all millennials, maybe to all people, but I think this meme is completely relatable. There are definitely conversations that I've certainly had at Thanksgiving dinner, and I think a lot of millennials do, which is this whole idea of everyone's telling you you need to get these years of experience, but you just finished school, but you now have a master's degree, but you need the years of experience to get a master's degree level job. And there's this kind of this discourse that goes back and forth. And I think the idea of the certificate program is it's providing direct access to that 2 years of experience essentially that they need, but through already being in their graduate program. And then once they graduate at the Department of Mental Health, they're kind of viewed as they've gotten that 2 years of experience right after graduation, essentially, with being a participant in the certificate program. So they'll directly qualify for their school mental health positions upon that graduation point, which I think is really great for our graduates because they don't have to worry about, oh my goodness, now I have to go get that 2 to 5 years experience somewhere. But I just finished school, and what does that look like? So it definitely is helpful, not only for the Department of Mental Health, but especially for our students.
Mm-hmm. So I can't call myself a millennial. I don't think I could pass for one at this point, but I certainly love memes, and in my head, I think I'm still like a 25-year-old or so. But so when Samantha created this meme, I was like, that's perfect. That's exactly what we've been talking about. This is what this program is intended to address. That you just finished your graduate program. You need a job. Well, you need experience for a job. Well, how do you balance those things? So that's what we were trying for here. And another way of looking at it is it's a 600-hour job interview, and we're looking for students to demonstrate the competencies over the course of 600 hours. Certainly not on day one, but over the course of 600 hours, we want to see how they acclimate to the DMH environment with our policies and procedures, and get embedded into the culture of schools, and then deliver the clinical services that we're looking for that's going to help the students in the schools. So great job with a meme. A picture's worth 1,000 words, and you got I think a meme can write a book.
I agree. This is kind of a brief description of what our program looked like specifically for cohort 1. There are a few changes in cohort 2, which we'll discuss, but like Christian just mentioned, this is a 600-hour internship. And the reason we did that is because we were trying our best to map on to what graduate programs are already doing, what are already required of students. We do realize that in some of our programs, these are more hours than they typically would be required. But we even found in this first cohort that even if we were requiring more hours than the student typically was being required by their graduate program, it still worked, especially because of some of the benefits associated with the certificate program. Students felt like they could make it work. They would be there for that time. So the 600-hour internship this go around was done in one semester, and we have been flexible with that, and we'll in our second cohort, it can be either a year-long or a semester internship, and we can get to that a little bit more. What you'll notice in this next kind of bullet point is we discuss the clinical experience, and that is such a great component of the certificate program. Is we are really trying to get these students a part of their community and their schools through these more specific clinical experiences. So they're first going to start shadowing their clinicians in their schools. Then the idea is to then get them into co-therapy with those clinicians and really getting direct service delivery. As in, we're talking about working with the Department of Mental Health, we want them to also get to know the Department of Mental Health and what that looks like as a state agency. And so that includes case management tasks and different case notes. They will also receive supervision as well as participate in interdisciplinary team meetings. So what you see here is a really comprehensive internship and with heavy on clinical experience. And we think that's really something that makes us even stand out as a certificate program. Mm-hmm. And then the part that the USC team, I think, holds really close to their heart is this professional development piece, because the students are going to be required, in this first cohort, we're required 20 hours of professional development over the course of the program. As we go into cohort 2, we'll be expanding that, and we'll talk a little bit more in detail about that.
Mm-hmm. So there were some challenges with this. We wanted this degree, the certificate program, to happen, across our mental health centers. I'm in state office, so I'm not, supervising the delivery of services out of state office. So we needed some buy-in from the center level, and fortunately, many of our centers stepped up and agreed to host the interns, which is kind of stepping out of their comfort zone a little bit with supervision of interns. Most of the time in Department of Mental Health centers, internships are in the clinic. That's typically where our supervisors are. They can have day-to-day supervision. They can just be there. They're supervising on a daily basis. So having an internship program that's out in the community, even though we want them linked with a seasoned school mental health clinician, those school mental health clinicians aren't always supervisors, and rarely are they supervisors. They're mental health clinicians. So there were some challenges with our some like I said, stepping out of some comfort zones from some of our centers. And another challenge to this was, we've now have 16 community mental health centers, and we wanted this degree program, certificate program, to be very consistent across all of those, all of the participating mental health centers. We didn't want an intern, in Lexington to have a different experience from an intern in Waccamaw. Clinically, as far as the clinical experience that they gain. Of course, there are going to be some differences in the schools that they were in and the center climate and culture and whatnot. But as far as what services that they gained exposure to and then ultimately progressed to deliver themselves, we wanted that to be very consistent across all participating centers. So, we put a lot of work into kind of setting the framework around that, and then fortunately, we were able to get the buy-in from centers and the degree programs to have the first cohort.
And I would like to mention, so this is kind of our brief program description, but how do we even get students involved and who are we connecting with? And It's been such an exciting process connecting with the different centers. I just got off the phone with a supervisor the other day who was so enthusiastic about this process and wanted interns for the second cohort right away. And it's been great hearing the buy-in that we're getting from the centers. And then talking to the graduate programs, they absolutely, right at the beginning, we kind of were calling people from these various graduate programs, letting them know about the certificate program, asking for their flexibility because this was our first cohort, and the buy-in has been tremendous. And as we go into cohort 2, they're, reaching out to us as we reach out to them, having conversations with us about the program, letting us know where things are working for their graduate program, where they may not work. So the communication has been constant with not only the centers, but the graduate programs, and their help along the way has been great because we've been able to figure out what, we may have thought one thing was clear and sound like it would be a good fit, and then graduate programs will let us know that doesn't work for the way, we have to do things for our credentialing. And then we could talk to centers and ask them about credentialing. So it's been a back and forth conversation, and that's been really great. It's definitely open-ended on our end. We're learning throughout this process, and I think the graduate programs and the centers have been pretty receptive to that. And everyone seems to have been pretty excited. So in this first cohort, we reached out to graduate programs, we reached out to centers. Graduate programs let us know students that they thought would be interested and be participating. And we started with a fairly small cohort of 7 because we started in January. So the second time around, we've kind of made some changes, and we'll discuss that. But that's how the first go around in terms of recruitment started. So I'm going to move us on into our kind of some of our milestones related to the certificate program. In our first cohort, we really wanted to discuss shadowing at the beginning. We felt like, they're coming into a state agency. We don't want to just throw them into the clinical experience without making sure they get their feet wet with, finding and learning about their communities and their schools. So we had our interns first kind of work through a shadowing process. In addition to that, they're being trained in the policies and procedures related to the Department of Mental Health, because that's likely to look different than any internship that they may have had previously. So getting to know those policies and procedures specifically was important to consistency. Go ahead.
And just jump in on that one bullet point. That sounds a little bureaucratic, to get acclimated to policies and procedures, and you're talking about a short term of employment, with the 600 hours, but it's really important information that's part of our onboarding process. So they're going to learn about corporate compliance so that they're protected, and aware of how to avoid any Medicaid, fraud, abuse, or neglect, or not fraud, abuse, and neglect, but fraud, abuse and waste. Because we are billing for services for the most part, not necessarily through the interns at this point, but they need to be aware of that. They need to be aware of our electronic medical record and how to, input information into it. They got to be aware of our quality assurance requirements, what goes into a clinical note so that it can be a billable service. They need to learn about the safety requirements of operating in the center and also in an outstation position. So there's a lot of things that are beneficial for the graduate students, in just their professional development and their ability to operate within the DMH system.
And I definitely think as a graduate student, there's some ownership in being incorporated into their, internship. So getting to learn the policies and procedures, you really feel as though you are a part of that DMH community. So I think it is an essential component for sure. We did have very clear competencies that we were interested in our students learning, and those include evidence-based practices, multi-tiered systems of support, and just overall school mental health literacy. So because of that, we were very particular about the different milestones, including observing at least 2 MTSS or positive behaviors in schools, PBIS meetings. And, we did run into our first cohort, some schools aren't PBIS, some are. And what's been great is that we've been able to connect with centers and find clinicians that are in those schools and make those connections, even if it wasn't the school that the student was originally, they were at least able to connect to a PBIS school by the time that they ended their internship. So the flexibility and the help from the centers to get those students to be able to meet that requirement has been great.
And we wanted them to be members of our interdisciplinary team. So the Department of Mental Health follows the medical model. We have physicians who drive our care. So all of our patients see a doctor. Our mental health professionals develop a plan of care. The doctor signs off on the plans of care. So it's a medical model, and then it's driven by an interdisciplinary team. So while it may be while these interns are in an outstation position embedded in schools, they also need to be part of the mental health center, and all of the patients that they see will be seeing our physicians in our centers, some by telepsychiatry that we can talk about later. So it's important for there to be collaboration with that interdisciplinary team. So that includes the physician, the mental health professional, nurses, peer support specialists, care coordinators, the clinic directors or supervisors. So there's a big opportunity for the graduate student to learn from the entire interdisciplinary team, and I think that's a big benefit of this program.
Absolutely. In addition, another milestone includes shadowing co-facilitating group therapy sessions. Again, similar to what I discussed previously about the PBIS meetings, there is definitely some flexibility around that and making sure that students are able to meet that competency or that milestone. Mm-hmm. We have some additional milestones. So this is where we're talking about conducting co-therapy. So we talked about a shadowing component. We then at some point want our students to be able to progress into that conducting co-therapy with their SMH professional. And we mention at least 3 sessions. We hope that it would be more. We put that there just to make sure that there is a consistent standard. And you can see it kind of goes through. The idea is that the graduate student comes into the internship starting with some shadowing and getting to know the policies and procedures, and then they'll transition to more independent role with the supervision, continuous supervision of the DMH clinician. Mm-hmm. So you'll notice that they'll be able to conduct comprehensive assessments at this time. Now they're leading and co-leading groups. They're going to be carrying out the policies and procedures now that they have a good understanding. They become proficient in the various softwares. And then now they're a participant in the interdisciplinary treatment team meeting. So the idea is that they're going to come in, they're going to learn about they're going to learn about DMH and what goes on. They're going to get to know their community and their school, and then they're going to be able to be more of an independent member at DMH with constant supervision. Yep.
So we really saw this as the 600-hour internship as a progression. So initially there may not be that much of the direct delivery of services, but there's going to be a lot of observation and getting to know, how do you process a referral that comes into DMH? What do those procedures look like? And then, there's a gradual buildup of the intern taking the lead with the delivery of services. And not only the delivery of services, because we know that they're gaining some of that experience in their graduate programs through practicum assignments. But we, wanted to make sure that they're able to deliver those services and also document them according to our system and in our electronic health record.
That's how I feel when we talk about professional development. So in this first cohort, we had a requirement of 20 hours of professional development, and the University of South Carolina School Behavioral Health team has been typically has been working on that. So that first 10 hours of professional development comes from attending the Southeastern School Behavioral Health Conference. We feel like that component allows not only for networking, but students get 8 breakout sessions, 2 keynotes, specifically targeting school behavioral health, and they're able to connect with other members at the Department of Mental Health from various centers. They're connecting with administrators, teachers, counselors, psychologists. It's really a great conference for them to not only network, but hear about different programs, evidence-based practices, positive behaviors in schools. So we felt that 10 hours of professional development would be dedicated to that conference. And
it's also a good opportunity for the graduate students who are participating in this cohort to get together, in person. We share lots of information with them, but typically all that is online. So this would just create an opportunity for them to share feedback with us about how the certificate program is going. And that was, for the most part, overwhelmingly positive. We got some really good feedback about how their internships are going. And we received some constructive feedback, and we were able to go back to the centers and make some changes. So that's a really good opportunity to have an in-person, it's a 2-day event, have some time where they're all together and we can spend them. And fortunately, at this last conference, Mr. Magill was there, so we were able to get the first cohort together with him. So that was great.
Yeah, that was fun. Then the remaining 10 hours is actually through a website, and the University of South Carolina School Behavioral Health team has created webinars using some of the BASC webinars. So something like today would be something that we would have the students watch and take either a proficiency quiz or do a write-up and connect with each other online. We also provided various research articles about learning about evidence-based practices, and just kind of went through an online portal of being able to talk about professional development that we felt was really important, and that especially related to school mental health. As we move forward into our second cohort, we're actually going to even be expanding that, because one component that we, after talking with students and supervisors and community organizations, is that we should get these students out in the community and doing trainings, especially free trainings that are possible to them. And we think that's a big component of professional development, especially once they graduate, being able to search and find trainings in the area. And we think that that would be helpful for them to learn that process, to discuss that process, where there may be difficulties, and different trainings that they think were really great. So we're going to be adding an additional 10 hours. So it will be a 30-hour professional development requirement, continuing with that 10 hours of professional development at the School Behavioral Health Conference, and then 20 hours using the webinars and learning evidence-based practices and et cetera on that website.
Mm-hmm. So lots of benefits to the students in participating in the certificate program. So as we've talked before, they're gaining a great deal of clinical experience with a diverse population. And the degree programs that are participating in this do a really good job of providing education and training and the delivery of clinical services. But I know from experience of hosting interns and even my work with DMH, there's nothing like the firsthand experience. So while it's maybe a little bit different in the school setting, the Department of Mental Health, our mission is to support the recovery of those with serious and persistent mental illness. And you don't always get the exposure to that in a degree program, especially if you're practicum assignments or at the University Counseling Center or other private mental health providers in the communities. You're not always seeing those individuals with severe persistent mental illness, or in those the children that we serve typically have what they call severe emotional disturbance. So I think that this has given them exposure to a diverse population that they wouldn't have access to otherwise. And also a wide range of services. We want them to deliver individual and group services. Family therapy is so important when it comes to working with children and adolescents. So that's something that we really emphasize, is that they get families involved with their treatment. And as we mentioned before, there's a great deal of professional development built into this certificate program. They're getting to know the DMH Center's policies and procedures, and getting an understanding of how a school mental health clinician it works in the school's culture. So, that's another thing that we wanted to make sure that they're getting training in, and also to help the student realize whether a school mental health position is the right fit for them. Do they really enjoy working in the school's culture? Sometimes clinicians feel like that's a balancing act because they're away from the mental health center where they've got much of their support through their employment with the interdisciplinary team. And they may, sometimes they may feel like they're getting pulled in different directions with the schools asking them of certain things. So this provides an opportunity for them to get some exposure to that. We want them to know about PBIS. We want them to know about, what happens in the schools with how a school mental health professional can help deal with a mental health crisis in the school. We want them to know how an IEP meeting is run and how they could participate in that and advocate for their clients and their families. So that's another big part of what we wanted them to gain out of this internship. It is a paid internship. We've provided at the Department of Mental Health through state office, we provided funding to our mental health centers to hire these interns. They are state employees. They are temporary employees. The classification is Human Service Specialist 1. So while they're paid at the minimum of that pay band, I think it's a good salary for the internship program, and we're really glad that we were able to do that. Not all internship programs are paid internship programs, so we're really happy that we're able to do that. And we work closely with the degree program so that our internship, this certificate program, is meeting the degree requirement. And hopefully, at the end of it, the students who go through the certificate program will be interested in working with us at the end of the internship program. Like I said, it's a 600-hour job interview, and if it's a good fit, then I think our mental health centers are going to do everything they can to recruit those graduates of the certificate program into those positions. There are a lot of benefits to, this is my meme, so I like those lists where it lists everything, there are lots of benefits, but the main thing is recruitment. We really created this to help us recruit those mental health clinicians to become school mental health professionals. We need this program to meet that goal of having school mental health available to all students by 2022. When we looked at that challenge, it just made sense that we need to work with our degree programs. They're producing graduates on a regular basis that we can credential to be mental health professionals. And this program just creates an avenue to get them into those school mental health positions as quickly as possible. So while that's the primary benefit, there are some other benefits to having the certificate program to DMH in our mental health centers. Once the interns are at a certain level, they're able to provide some clinical coverage. So if a clinician is out, at a center, typically, maybe not in the school setting, but they could help provide some clinical coverage. We're still not able to bill for the services that the interns are providing. Dr. Bank and I are going to be hopefully talking with DHHS to allow the billing if the services are also co-signed by a mental health professional, a credentialed mental health professional. So that's something that we're going to be working towards in the future, but currently the services that these interns are providing are not billable. But they are able to provide some clinical coverage. And they are helping our supervisors develop their supervision skills. So we are asking more of our supervisors that are supervising the interns of this certificate program. So it is helping them develop some supervision skills. And it's also helped us improve our relationships with our colleges and universities that produce the college graduates that we can credential as mental health professionals.
So this is kind of a good picture, a good representation of our first cohort here. Mm-hmm. So I think I alluded to it earlier that we have various programs and universities. So you'll see we have 4 different universities. So University of South Carolina, Winthrop, Francis Marion University, and the Citadel. And what's really great about that is that includes MSW, so Masters in Social Work. So we have counselors education. We have some, so we have different programs participating, not just different universities. Yep. And then, go ahead.
Well, I was going to say, so 2 degree programs from USC, social work and education, and also Francis Marion, that's the master's degree in psychology. So it's a wide range of degree programs that are currently participating, and we're hoping to expand that for the next cohort.
Absolutely. And we have 6 mental health centers this first cohort participating. So you see Lexington, Catawba, PD, Waccama, Charleston, Dorchester, and Berkeley. And then we have our first 7 here. So we have our 7 students. And just, I think the monetary amount that DMH is committing for these students just shows how, and I think how impactful this internship certificate program can be for the future, especially. So this part is definitely kind of what we're moving towards. So this is our cohort 2. So we've discussed cohort 1, and I've alluded to kind of some changes that are going on in cohort 2. So some of the big things that we're doing is we're going to evaluate kind of our outcomes. So we've talked with students already at the conference, but we want to also talk to our supervisors. So we will be sending out a supervisor survey to get some feedback from our supervisors of cohort 1, see how we can make some changes in cohort 2. We also plan to hold a student focus group with our cohort 1 students, as well as do a survey with them, kind of an outcome survey. We provided a pre-survey, just kind of students' basic knowledge of school mental health literacy, evidence-based practices, and multi-tiered systems levels of support. And since those were some direct competencies and milestones that students had to meet, we'll be giving them a post-survey to see how the certificate program has impacted their knowledge in those areas. We've also developed an application process, which we think has been really helpful in getting to students who are specifically interested in school mental health. As Christian mentioned, it's a specialized area, so students may not know or may not have had experiences in schools previously. So getting to know what that looks like and how that may differ from a community mental health center is really important to us. So the application allows us to review students and see, are they a fit because are they interested in school mental health services? So the Department of Mental Health and the University of South Carolina reviews those applications that are given to us, and we then recommend them to the DMH centers. Go ahead.
I was just going to say, and then when we're in the process of, we'll make a decision about accepting someone into the degree, certificate program, and then we're going to look for the best match with the mental health center where they'll be placed. So, and part of the application process, we ask students what area, either by center or area of the state that they would be able to work in, and then we do our best to try to match them closest to their preference.
Absolutely. And we are continuing to expand the number of universities and degree programs represented, which I love. I just got off the phone with Clemson, and they were such a great group to talk with. And after the phone call, they were like, we're going to go talk to students now. So I think that's been really great. So the University of South Carolina, Aiken, Clemson University, Winthrop was continued. So we are just hoping to continue and expand. The University of South Carolina has been great, along with the other degree programs like FMU and the Citadel. So we hope to continue those relationships and expand them more. Mm-hmm. So if anyone that is listening is part of a degree program that maybe isn't participating in the certificate program now, and you have students that you think would really be interested, please connect with us. Our contact information will be at the end. We'd love to connect with you and talk to you more about the options related to the certificate program. Because we started with 7 in our first cohort, and we're trying to increase that number to about 15 to 20 graduate students. So we've had applicants already apply. We have some students accepted. We have a rolling admissions process. We are going into the summer with continued conversation with graduate programs, and we have students weekly emailing us applications. So we will continue to do that until we kind of hit our cap number of 20. So as we increase the number of participating students, we also hope to expand the number of universities and degree programs that we work with. Mm-hmm. This last point is important because we kind of worked off of a template and rubric in this first cohort, and just to, based on the communication with our students this time around, as well as different centers, we wanted to anticipate some of these bureaucratic delays, and so we have developed a certificate program manual, which we will go off of. And the idea is to make sure that all of our supervisors and students will kind of be trained in that manual, get a good understanding as we go into cohort 2. Again, just to emphasize consistency across all internships, since they will be at various Department of Mental Health centers.
Mm-hmm. I was just going to make sure that Danielle had a recording of the USC student complimenting Clemson.
Yes, that is on Facebook Live. It's streaming. It's been captured.
There we go.
I did my undergraduate at a small liberal arts school, okay? It's not maybe as deep through my veins. I'm welcome to all universities.
Glad to hear.
So this portion, I think we want to open it up to questions that you guys may have been thinking about throughout the webinar, about the process or about where we are now. So if you want to use either that chat feature or the Q&A feature to ask any questions that you may have. While we kind of wait for questions, what I will do is move us onto our contact information slide here. You'll notice at the top where it says weebly.com, that is actually where students can go to find the application. And we have Christian's email as well as my email here. And I see a flash for a question.
So yes, Tricia, that is what we work with HR on. That's the kind of I meant to say that during the presentation. But so what we're able to do now that we're completing the first cohort is when we start advertising for school mental health positions, we're able to post the advertisement as having the requirement of a master's degree plus 2 years experience or a master's degree and the John H. Magill School Mental Health Certificate. So that's going to be able to serve in lieu of those years of experience.
I think the next question is great to clarify. So the question is, you must be enrolled in a graduate program to enroll in the certificate program. That is correct. We are asking graduate programs to talk to their students in their final year. So whether they're in a 1-year program, a 2-year program, a 3-year program, when they're in that final year of their program, they can then participate in the certificate program.
Thank you, Courtney. Thank you, Dr. McGeorge. Glad you were able to join the webinar. I saw earlier there were some people on the phone. Do we know if we've got ability to open the lines up to see if any of them have questions since they can't type?
I can go ahead and unmute all participants.
Okay.
Just not sure if they're having conversations or outside of the office. I don't know.
This is your warning.
How about if anybody is on the phone, you have the ability to unmute yourself, because that should be an option when you call in from the phone.
Do you know what the code is?
It's like a *5 maybe, but I am not sure. Let's see.
Okay. So if you're on the phone, my email address is christian.barnes-young@scdmh.org. Samantha is much easier. It's S-T as in Tom, but probably not Tom, stm1@email.sc.edu.
You mean my name isn't Samantha Tom Martinez? Or?
That would be cool, but that's not. What is it?
It's even longer. Not even worth it.
No. So reach out to us if you have any questions. We'll be happy to try to answer them. If you know of degree programs that would be interested, feel free to let them know about it. And if you know of any graduate students who are looking for an internship opportunity in schools, send them our way or have them look at that the link to the website where more information is available. We're really excited about this program. So far, the first cohort is going well. I set a goal when we knew we had 7 for the initial cohort. I had a goal that we would recruit 2 of those, and I believe we, fingers crossed, nothing is finalized yet, but I believe we're going to exceed that expectation. We're going to. I'm hearing that there are more than 2 that are interested in staying on with Department of Mental Health and school mental health physicians after the certificate program.
Which is awesome. So I just want to, clarify and emphasize that if you have anybody that has interest, questions, we are definitely open to having conversations. I'll get on the phone and talk more about the certificate program. So please email us if you are if you're interested in being a supervisor, if you are a graduate program, if you know a student. We definitely want to get the word out there even more. So if you know anyone, please do not hesitate to email.
Okay.
I think that might be it.
No more questions, so we'll call it a day.
Awesome. Well, thank you all for taking time out of your day to join us and talk about the certificate program.
Thank you.